If you've seen my Lantus vs. Toujeo video, chances are you've also seen another video by a doctor here on YouTube called Stephen Edelman. And his video is entitled Toujeo, a better basal insulin. Now, in our respective videos, we have contrary views of this new insulin, Toujeo. In my video, I say that it is a less effective insulin because you have to use more insulin to get the same results, approximately 20% more. Since you have to use more insulin, you have a higher chance of getting more of the same side effects, obviously. But not only that, there's a greater chance of developing what are called drug immunities. And also, on top of it, you'll have to pay more money because you have to use more insulin. In his video, he says the exact opposite. He says that it's basically superior to Lantus in every way, and that it's just all gravy, and he doesn't mention anything about it having possibly anything negative compared to Lantus. Watching both our videos has been difficult for a lot of people who want to get to the bottom of the Lantus versus Toujeo question. They want to know the truth. So what I want to do is distinguish the information that I used in my video versus the information that he used in his. So firstly, I want to begin this discussion with the package insert, because the package insert is where I got all of my information for my video on Toujeo. And the significance of that is, what is on the package insert is what you can prove about a drug. So I want to make a claim that one drug has fewer side effects than another drug. Well, I have to conduct a clinical trial showing that there are fewer side effects, or whatever my claim is, that it works better or that it lasts longer, whatever the claim is. You've got to prove it, and if it is proven, it will be on the FDA package insert. And the reason I bring that up is because I've read this package insert back to front several times, and I don't see anything about hypoglycemia, about there being fewer hypoglycemia events, or there being less weight gain, or several other claims that he makes. So a lot of drugs have off-label uses, or people make claims about certain drugs, but they can't prove them. Otherwise, they would be on the FDA label. Because if it's on the FDA label, then as a pharmaceutical company, what you're allowed to do is to market it and say, yes, our drug has fewer side effects. It does do this, or it does do that. So it is in their interest to prove it so that they can market it that way. Otherwise, if I were to call Sanofi right now and say, does Toujeo have less hypoglycemia? Do you gain less weight on Toujeo? You know what they would say? No. Because if they said yes, they would be committing a crime. And in his video, he uses a series of studies that say the opposite, that say that there is less hypoglycemia, that say that there is less weight gain, and other claims. But if I open this package insert, and I've read this back to front several times, it's not very long, I see no mention of less hypoglycemia. I see no mention of less weight gain. And I know exactly what studies he's using and talking about, because those studies were submitted to the FDA, but they were rejected. And the reason that they were rejected is because Sanofi was trying to manipulate the data to make it look like there is less hypoglycemia, to make it look like there is less weight gain. So they were just trying to get away with that, and the FDA rightfully rejected that information as manipulative. Now, I understand that the FDA package insert can be a bit of a bear to read for the average person, but the guidance for the National Institute of Health and Care Excellence in England makes it very crystal clear. For type 1 diabetes, which is the same type of diabetes that Dr. Edelman has, let's read under effectiveness. Once daily Toujeo was non-inferior to once daily Lantus in A1C reduction at month 6. Now what that means is that they get the same results in blood sugar lowering. Lantus and Toujeo, no difference. Let's read further on. Hypoglycemia, or severe, confirmed or severe, nocturnal or severe, did not differ between Toujeo and Lantus at 6 months in people with type 1 diabetes. Now, why is that opposite to what he said? He said that it does lower it, but yet you have the FDA package insert and you have the National Institute of Health and Care Excellence saying the opposite of what he said. Why is that? Let's read further on. At 6 months, the basal insulin dose was approximately 18% higher with Toujeo than with Lantus. And that's all it says under effectiveness. So I've got something that it says gets the same results as Lantus. Point number 1. Point number 2, it does not have less hypoglycemia. Point number 3, it uses 18% more insulin. And those are the only 3 points under effectiveness. That's it. But this doesn't make any sense. Why would someone who is clearly very intelligent and highly educated be making all of these claims using FDA-rejected studies and basically going against every drug-approving agency in the world and touting all of these benefits for which there is no backup for? Basically, every agency says, yep, it's the same as Lantus, except you have to use more insulin to get the same results, no benefits. Why would someone make those claims? It's not like they get paid for it, or do they? If I search for Dr. Steven Edelman in the Medicare Open Payment System, which is a system that tracks payments from pharmaceutical companies to doctors, I will find that in the year 2014, in 1 year, he was paid $357,890.89 in 1 year. This is on top of what he already makes. This is just what he's been paid from pharmaceutical companies. And if we look at the list of who's making the payments, at the very top, Sanofi Aventis, $20,000. And if we look at the list, this list is dominated. 11,000 from Sanofi, 8,000, 8,000, 8,000, and the list goes on and on. This insulin is trash. The fact that this company had, for 15 years, the best-selling insulin of all time, which have been consistently making over $10 billion a year, plus, after all of this time and all of this money, this is the best they could come out with. Well, let's just triple the strength of the insulin we already have. After 15 years and almost $100 billion, that is the best you could come up with? Just to see how much of an utter joke this product is, let's compare it to a different industry. Let's say you bought a car 15 years ago, and you go back to the same dealership 15 years later, and they offer to sell you a new car at the exact same price, but it's the exact same car. Literally the exact same make and model from 15 years ago, from the body design, from the parts of the engine, right down to the carpet on the inside, exactly the same. And they tell you that the only improvement is that it has a gas tank that is 3 times as big. But at the same time, it uses 20% more gasoline. Do you think that's an improvement, yes or no? Because that is what this guy is trying to tell you. He says that if you take a car, make the gas tank 3 times bigger, and make it use 20% more gasoline, it's a better basal insulin, right? It would be a total joke. You'd be laughed out, but only in pharmaceuticals can you get away with some nonsense like this. Now maybe those payments didn't have an influence on his opinion. But when you're rubbing shoulders with a group of losers, like the people at Sanofi, who want to charge you $500 for a box of this insulin, who they must have had R&D working night and day for the last 15 years to come up with this farce of an invention, it doesn't look good on you. I hope this helped explain the differences between our positions and how we got there. I hope you found it helpful, and I'll see you next time, nation.